All right, y'all, in this week's Healthy Colorado Conversation, the reasons women's health should be on top of your mind. OBGYN Dr. Tiffany Wilson is here. Hello, good to see you. Thank you for coming to advocate for women's health. So breast health is top of mind. I know anybody watching knows someone who has had breast cancer or gone through something like that. At what age are we really supposed to be talking to our doctors about breast health and mammograms?
So mammogram or breast cancer screening usually starts between the ages of 40 and 50. Our major governing bodies are a little bit of a house divided, but I usually recommend for patients to start mammograms at age 40.
Okay.
And then they're, again, house divided on whether or not you do them annually or every 2 years. I'll be very honest, I'm likely to forget, so I just do them annually so I don't have to worry about it.
Smart.
And a lot of the times we might remind our patients, just do it around your birthday.
Yeah, I was just going to say,
like
give
every
yourself
year.
the birthday. I always was thinking about that. And I do the mammograms, guys. They're not terribly painful. And I always chat up the nurses and everyone's having a good time.
No, I mean, it's a little squeeze, but really and truly, most of the technicians who are doing it do a good job of keeping you a little bit distracted so you don't know what's going on. And then before you know it, it's over.
Exactly. Okay, so I'm at a certain age, well written, by the way. What other screenings are there is important to talk to your doctor about?
So really and truly, it kind of depends on when you begin your OBGYN journey. And I actually recommend that young women start seeing their OBGYN even as early as maybe 13, 14, not necessarily for anything specific, but just to sort of start building that rapport because, I mean, women's health and OBGYN physicians, we sort of travel with you through your entire lifespan. So when you start to, the first screening is obviously when you become sexually active, we really want to talk to our young women about screening for sexually transmitted infections. So that's very important. Highly recommend, obviously, safer sex practices, so protected intercourse as much as possible, but things happen. So we definitely want to make sure we get screened for those infections. Pap smear screening or cervical cancer screening usually starts around age 21.
Okay.
And that's usually every 3 years until age 30.
Okay.
And then at age 30, we start adding in HPV screening or human papillomavirus screening. And as long as those tests are negative, then we space out to every 5 years.
I heard that. Like, I was going every year, but then they're like, you can wait.
You can wait. So this is an important distinction to make.
Okay, good.
You still should visit your OBGYN annually because there's other things to talk about. Like we still talk about breast health. This is the time where we might talk about, okay, what's going on with your hormones, like perimenopause, thyroid screening, things like that. So you still want to see your OBGYN every year, even though you might not have a pap smear.
Okay, I did not know that, and I wasn't doing that. So thank you, Dr. Wills. I absolutely wasn't.
Please come visit your friendly local gynecologist.
I will.
We'd love to see you.
And it's like you said, at 13, it's important to have like trust with that person. That's a very intimate relationship you want to have.
So intimate.
Yeah, exactly. Okay, what are your opinions about when I was a kid, the breast self-exams in the shower? You lift your shoulder. Is that still going on? Do
100%.
I thought so. Okay.
100%.
Good, because I'm still doing that.
As you should. A large volume of women actually do detect their own breast lumps and bumps. And then go to the doctor and say, hey, I felt something. Can we work this up? Can we evaluate it? So breast self-examination is really important. Highly recommend to do it once a month. Choose the same time each month.
During your period, can you do that?
You can do it during your period or a couple days before or after is usually what we recommend, just so that it's the same time because then you know exactly what your breast tissue is like at that time of the month.
Smart.
And, especially for some of those of us who might have dense breast tissue.
I have dense breast tissue,
Same, right?
Yeah.
Me
Hey,
too.
right on.
So then it's like, okay, you get to know what your girls feel like.
Right.
You really want to know, okay, these are mine, they live with me every day. So you get really comfortable.
I name mine, it's great. Okay, some of the signs we should be looking for are things that are signal to make an appointment. I assume any kind of pea-sized lump or anything hard.
Anything that is a change.
I see.
Lump or bump, change in visualization, like before you start your breast exam, the first thing you want to do is look in the mirror.
Yeah, exactly.
Do they look the same? Are they about the same size? Now, breasts are not exactly the same size. One is usually slightly larger. But if you start to see any skin changes, darkening, anything like that, in addition to lumps or bumps, if you are pressing the nipple and you're noticing a discharge,
yes, I've heard of
you
this.
Definitely want to head to your OBGYN and ask questions. Some discharges are normal, but some are abnormal. And we are there to help you sort of figure out, okay, do we need to work up this further or is this absolutely normal?
Got it.
So for breast exams, those are some big things. In your vaginal area, in your lady parts, as I lovingly like to call them.
Lady parts is beautiful.
Lady parts. You got to take care of them. If you notice any change in discharge, anything something that's uncomfortable, an itch, a burn, a bump, anything like that, come visit us.
Got it.
We absolutely want to help you on this journey.
And
so
even though it might feel embarrassing, they're used to this.
Please don't be embarrassed.
They're very used to the lady
Please
parts.
absolutely don't be embarrassed. This
Exactly.
is one of my favorite parts of my job.
There you go.
Taking care of women, educating them, and helping people to advocate for their own health care.
And live longer.
Yes,
absolutely.
absolutely.
Okay. I do want to ask about hereditary, because you and I were talking off camera beforehand. BRCA gene, sometimes I'm like, with the Alzheimer's gene, you're like, do you get it, do you not? You advocate for people, if you do have a family history, to get the BRCA gene tested, right?
Absolutely. So hereditary cancer screening has sort of erupted onto the scene in the past few years, and I think it's absolutely amazing because it gives us a body of information to work with sooner in life. Sometimes then we have symptomatology. So number one, talk to your family members about what's in your
And
history.
when you say that, are you saying immediate? Am I going to my grandparents, my cousins?
As much information as you can get.
Okay,
Because sometimes
okay.
what you will find is there's a trend in the family. Oh, my mom had a lump or bump, grandma had a lump or bump, auntie had a lump or bump. And now we have this family history of breast cancer. And that's important because sometimes when you have a family history of breast cancer, that screening mammogram or ultrasound or MRI might happen sooner than that 48.
For sure.
Because then you're looking at what is called your index case, which is the youngest person in the family who's had it, and you want to screen before they had it.
You know where I heard index is from Olivia Munn, who's done a nice job of bringing awareness to this after she had that.
100%.
Yeah.
I mean, I really enjoy that so many of our prominent figures are speaking up and, basically bringing this to the forefront and destigmatizing.
Yeah.
Which is so important.
Totally, and using their platform for good, which is unbelievable.
Yes.
You're incredible. I feel
you.
kind of want her as my doctor. Okay, so I will come see Dr. Tiffany Wilson. Human kindness is what CommonSpirit Health is all about. Visit their website and search for hospitals and doctors like Dr. Wilson in your area. Go to mountain.commonspirit.org. Find more interviews and information on 9news.com/healthycolorado. This Healthy Colorado segment is sponsored by CommonSpirit Health. Doc, thank you so much for what you do.
Thank you for having me.
Absolutely.